Good day, everyone. Let's get started with our uh, next lecture. One or two announcements before that. I will ask you to please visit our exhibitors in the room where the coffee and food is. Please visit them. Their presence here helps support this conference and helps us keep our fees down. So we do appreciate that, and we'd like them to come back and further support us. And the second thing is we have a special guest here that is over in the exhibit area, Miss Heather Turner, who is a national representative for the ACSM. So if you have any questions about the national organization, or especially for the students, both undergraduate and graduate students, if you would like any information on what grants may be available, I've had a few students ask me about national research grants. She is the person to ask. She only comes here about once every 5 years. So she'll be at a table in the exhibition area. So please, take advantage of that. If you have any questions about national or any questions about grants or programs for students or any other researchers, she can give you that information. Okay, so let's get on with our next part of this. It's my pleasure to introduce our next speaker, Melanie Austin. Melanie is an associate professor and assistant chair of occupational therapy and community relations at the New York Institute of Technology. She is a faculty associate with the New York Tech Center for Esports Medicine. She holds both a doctorate degree in occupational therapy as well as a master's degree in public administration. Dr. Austin's research focuses on mental and behavioral health, prevention and health promotion for youth, young adults, women, students, e-athletes, and vulnerable populations. Her scholarly work has been featured in multiple media platforms, including the American Council on Exercise, CBSN, the Academic Minute, Science Daily, St. Louis America, and Working Mother. And she is a former NCAA track and field All-American. Yes. She is passionate about empowering people to live healthy, meaningful lives. Her presentation today is titled Healthy Daily Routines and Quality of Life for Esports Athletes. Please welcome Professor Melanie Austin.
Thank you so much. And thank you to Alex Lopez and Amerigo as well. Thank you all for being here. Thank you for having me. I sound so important, and I'm really not that important. I'm going to talk to you today about a holistic aspect of treating and working with the esport athlete. Okay. See if I can get okay. So just a question first as we get started. How many of you are esport players? We have a few. Okay. How many of you are traditional athletes? Or traditional athletes? Okay. All right. So you have some thoughts about esports and what esports is, and the fact that esports now is becoming one of the mainstream types of sports. So I have this definition here of esports: performance sports where the primary aspect of the sport are facilitated by electronic systems. That is video gaming and broadcasted via the internet. So very different, right, from our traditional way of thinking about sports. And so for me, especially as someone who was a traditional athlete, I had to really think about this for a second. Is this really a sport? Is it really athletics? And then I thought about how meaningful sports was to me, that I valued it. It was something that occupied my time. And it was something that, I aspired to do better in, and I valued it. So it had meaning, purpose, and value. And I loved the competition of it as well. And then I said, okay, well, the things that esports athletes and esports players, they value what they do, and it's competitive, and they just do it in a very, very different way. So like many of you, when I was running track, I was in track line when I was in athletics. And, things are changing, and it's time to change with the times. And so really thinking about how we use ourselves, mind, body, spirit, right, to be able to participate in the activities that we enjoy doing. Sport, for instance, I remember the Division II NCAA, they had mind, body, sport, and so I said, okay, now we have to figure out mind, body, sport. And so really thinking about from traditional sports to this whole new era of so changing the game, right? And so esports is really changing the game of how we participate. And although as a traditional athlete, we are dealing with the whole body, physical exertion, and but also really psychologically preparing yourself for being able to play your sport. And so I asked myself now, how are we changing the game? We have, to really think about the esport athlete and what's going on holistically in order to be able to make some change. And so, yes, things are changing, but we know that with change comes opportunity, right? And so we have a great opportunity as healthcare professionals, as educators, as clinicians, parents, family, community, to really make a difference and to really look at the esports athlete from a holistic standpoint. And so I'm going to talk a little bit about prevention and health promotion and mental health, because we know the data is showing that the primary concern regarding gaming is the addiction, it's the mental health, it's conflict management, it's anger management, it's isolation or socialization. Those are some of the negative aspects, but I'm going to talk to you a little bit about some of the positive ways that we can work with and prevent some of these aspects. All right, so where are we now in terms of prevention, health promotion, aging well, longevity, and quality of life? The esports world is very, very new, so there's still limited data on, aspects of positive or negative effects of esport gaming, right? And so there's still a lot of things to do when it comes to working with esport athletes. So I think the idea of prevention and health promotion, aging well, should be one that's really important, because we have an opportunity now to grab hold of it and to really think about what it's going to look like as we move forward, right? And so we want to really think about what's going on inside that body of the esport athlete, right? And so thinking about how we want them to have good health as they age and increase longevity and quality of life. So those are some of the things that I am interested in as an occupational therapist, but also as a team member at the NYIT. And so I looked at some data prior to COVID. And prior to COVID, over 40% of adults play video games. And for teenagers, 26% said they spend too much time, about 22% said that they spend too little time. So they got some mixed data there. And so we know that there have been a lot of changes due to COVID, and the pandemic has caused people to, kind of stay inside and, more gaming and more. And so that really did increase the amount of people who are playing, who are gaming. And so I found this data on the Pew Research Center, which looked at teens and how often they're using the internet for not only gaming, but also for other activities as well. And so the percentage of teens who are actually using the internet and social media for gaming and other activities is increasing. There's also a lot of new data that shows the negative aspects of like bullying and being harassed when people are using internet-based gaming and other internet-based social media activities, right? And so there's a lot going on within the whole arena of using technology at this high rate. But I also wanted to point out that we have to think about globally what the World Health Organization is saying. We have to look at nationally what the Centers for Disease Control is saying, and then look locally at our own health organizations as well. And so the World Health Organization has now included the 11th edition of the International Classification of Diseases. And they've been actually looking at issues related to gaming and looking at the adverse effects and really thinking about how we can work together to kind of help to develop more prevention measures. So we know that esports is really going to be the future, right? Traditional sports are not really going anywhere, but esports will definitely be, it is now a global competitive arena, but it is going to continue to grow. And so now we have players of various ages and various stages of life, right? And we have school age programs. And so in our high schools now, there are esport teams. As a matter of fact, I did a conference with the Department of Education, and really they were looking at how do we help parents and families and teachers to understand this whole aspect of esports. And so we have esport teams in the high school setting. We definitely have esport teams in the college setting now, and there are conferences. And so the conferences are actually including esports within the conference. And so that is really something to think about. And then lots of professional leagues, private professional leagues as well. There's the World Cyber Games. And I have been trying to follow the interest in esports becoming an NCAA sport. And so I think that is on the table. I've also read some statements from the Olympic chairperson who says that the esports may not be a sport in the 2024 Olympics competitively, but there will definitely be some mention and some notice of esports in the 2024 Olympics. I'm looking forward to that. And in addition, Special Olympics as well. And so with all of the wonderful information that Alex just presented, we're going to see some new teams emerging as well in the Special Olympics arena as well. So as I mentioned, there's limited evidence when it comes to looking at the whole person and understanding all of the different aspects of care that we need to look at. And so we need more data when it comes to not only the physical status of and concerns and impairments and difficulties related to physical conditions, but we also need to look at the mental health, the emotional health, the social health, of course, the virtual. Socially, environmentally, personally, we have to look at all of the areas of need of the esport athlete. And so some of you may be familiar with the DSM-5. So that is the Diagnostic Statistical Manual of Mental Disorders. And what's new about the DSM-5, lots of things are really new about the DSM-5. One is that it's addressing mental health from a cultural perspective. And another is that the gaming has been considered as something that may become a disorder in the future. So internet gaming is actually listed in the DSM, not necessarily a diagnosis yet, however, because new data still needs to emerge from that. But it's really great to see that at least we will be addressing esports and mental health behaviors and mental health needs from an evaluation and an evidence-based standpoint. Okay, so the DSM-5 states that internet gaming disorder is the compulsive preoccupation of some people who develop playing online games, but they do that at the exclusion of other needs and interests. And so that's what I'm really passionate about, is really understanding a little more about the esports athlete and what their needs and interests are. And so the internet gaming disorder states that a person will be diagnosed with the esports gaming with a internet gaming disorder if they have a significant impairment or distress within their own life, right? So that would mean that we really need to know a little bit more about the esport athlete and their life, right? And how they do things in their life. And so we have to ask ourselves, and we have to ask esport athletes: do they become preoccupied with gaming? Do they withdraw from? Do they have withdrawal symptoms? Do they spend more time, and more and more and more they need more time gaming, right, to kind of satisfy that urge to be gaming? So that's kind of leaning into addiction, right? Do they have an inability to quit, and do they lose interest in other activities? Do they deceive others about how much time they're spending on the internet? And what about their moods and their emotions, right? And does it impact their work performance, their productivity, their education, and their work? So there's some potential risk factors and health risks that esport players may experience because they spend so much time gaming. So sleep disorders, stress, anxiety, depression, social problems, injury, violence, and other chronic conditions. So the negative effect of gaming and the negative effect of the athletic performance related to gaming can really stimulate overtraining syndrome, right? And that's also common with traditional athletes. They can have slower, less accurate cognitive performance, and then they can also have declines in split-second decision making. But I want to talk to you a little bit about some of the positive aspects of using the internet, using social media, and also including gaming as well. And so some of that research has identified that for young adult college students, they have reported increased relaxation, leisure, greater social participation, and also greater satisfaction with their daily routine. And so those are some positive aspects of internet and gaming use. And there's also research that shows that technology and social media can be less pressuring and demanding on the mind and the body for those who are engaging in their academic coursework. So that is really promising as well. At the New York Tech Center for Esports Medicine, Donahue and Zweibel and colleagues have developed an integrated model of health management. And this is primarily looking at the collaboration and the stakeholders, all stakeholders involved in the esport players' life, and looking at developing new clinical practice guidelines for esport players. And so working with sports physicians and all of us as health professionals in order to really understand the medical needs of the esport player. And so really including the esports into the sports medicine curriculum. And so that it should be emerging. You'll probably see much more academic work. I've actually seen where there are new programs being developed just to teach courses on esports. And so there's a lot of new and emerging opportunities for us as healthcare professionals. And so this is a great model. You can all look it up. The integrated model. I think I have another slide with it. But I've also looked at some other recent data. I wanted to see what was going on in 2022, 2021, 2020. What's going on now? And so this article actually identified that performing gaming activities had a positive cognitive effect on children. And so there's a lot of new data coming out that shows a really great opportunities for us. This article, Playing into the Future by Dr. Donahue, who is a faculty member at New York Tech as well, really is looking at what can we do and really trying to bring us all together to determine how can we address some of the issues that are emerging with esport athletes being sedentary. It's an activity that definitely requires a holistic approach. And so I'd like to propose that we think about our theoretical models that we're using and that we're learning and that we're teaching, and evidence-based approaches. And so what comes to mind is the social ecological model, which looks at the person, but actually expands to look at the family, the community, and then what are the social political factors that enable us to develop new techniques and programs and models and approaches to working with the esport athlete. Some of you may be familiar with the trans-theoretical model of behavior change. I think this is a great model to use when we are when we want to help an esport player maybe think about making change in their daily routine and making change in their daily activities, the time that they spend on the activities, maybe managing stress or getting more sleep. And then also thinking about the self-efficacy. You know, self-efficacy is another component that we sometimes miss addressing when we're developing our intervention plan. And so with self-efficacy, we want to make sure that there's a fit between the goals that the esport athlete may have and their confidence level to be able to reach those goals. And so that's what we mean when we're talking about self-efficacy. And so there really is a need to develop more evidence-based outcome measures. And so again, we have a challenge, but we also have a great opportunity to develop interdisciplinary, multidisciplinary outcome measures. And so we have to think about health professions and collaborating with all disciplines. And so this should be a cross-disciplinary approach, right? And bringing in clinicians and researchers and educators who are knowledgeable about developmental stages of life so that we can actually match those as well with the esport player. We also have to be mindful of the social cultural norms, right? What's going on in society today? What are the social cultural norms, right? And so it might not necessarily fit. My grandchildren tell me all the time, it's a new era, you know, and I'm so trying to do some of the old things. And so we have to understand what's going on in society today from a social cultural perspective. And most important that, you know, one of the things that I like to do is talk to the esport athletes themselves. And I've had an opportunity recently to talk to a few of the esport athletes and get their opinion and their voice and what's meaningful to them and find out more. So the voice of the esport athlete should drive the approaches that we are going to develop and implement, right? And so they should be a partner in that. So we have to think about our roles in healthcare, our roles in the academic setting, but we also have to think about more research, and we have to really focus on the immediate people who are going to be with the esports athletes, right? And so that might be the trainer and the mentor, the coach. But as clinicians, we will have to take on some of those roles as well, and we may find ourselves in the role of mentor, of coach, right? And so we have to really think about how we're going to, as a team, work with esport athletes and know that we can't operate in silos, right? We have to think about prevention, health promotion from a holistic perspective, right? And so one of the things that we have to focus on is we say person-centered, we say client-centered, and I'm going to say esport athlete-centered. We have to center what we're doing around the esport athlete. We have to focus on their habits, their roles, their routines, and help them to make small incremental changes in their daily lives, right? But it definitely has to be something that's meaningful and motivational for them, right? To get them in that flow that Alex Lopez just talked about. And so it's a great opportunity, I think, for students. I think it's a great opportunity as well for internships, for fieldwork placements, for experiential education. And so I think there's an opportunity for us to grow in society and be able to stay in the game as esports is kind of taken off, you know, really quickly. So again, I mentioned the whole person. So what I like to do is really focus on the person, as I mentioned. And so I want to know, who are you? I want to know what's meaningful to you. What's your why? Why do you play esports? And I think that's what enables me as well, as someone who's a former traditional athlete, to understand the importance of being able to perform that activity as an esport athlete. So find out who they are and what they, and, you know, what do they want to do to be healthier? And so we get that narrative. And so I think we have to focus more on that because each esport player is going to be very different, right? Everybody's their own unique person. So we have to think about what are their vision and their goals for themselves. What is it that they want to accomplish? And all of the best opportunities for them as well, whether it's playing esports, whether it's developing the technology to enhance esports, whether it's the organizations that when they become entrepreneurs and develop their own organization, what is their career long term, right? So just as for a traditional athlete, where we say, you know, there's got to be life beyond basketball, football, track and field. What's life going to be beyond esports? And so we have an opportunity to kind of step back, look at the whole picture and address the esport athlete from that perspective. And so an interview and data gathering and process that we're going to have with the esport athlete, we want to really focus on all of the skills that we bring as clinicians to the table, right? Observational skills, we want to think about data gathering, establishing a rapport, therapeutic use of self. Those should be the same approaches that we use when we're working with an esport athlete, especially because we're dealing with potential high rates of addiction, suicide, depression, anxiety, and many other types of disorders, right? And so the goal should be to understand the culture of esports, understand, of course, the culture of the person, but do it with professionalism, communication skills, excellent communication, excellent nonverbal communication, verbal communication, using our clinical reasoning skills to gather data, but also into professional practice. I think it's really, really important. And so for the esport athletes themselves, right? Just like you're working with any other athlete or any other client or patient, you want to determine if they have insight and awareness. Are they aware of challenges and barriers that they may have in their daily life and their daily routine? How do they perceive that, right? We know stress is most stress is a perception, right? So how do they perceive that, right? And then how do they deal with their emotions, right? Do they have emotional intelligence and emotional regulation skills? So we really can work with them from the standpoint of understanding the mental functions, right? Self-expression, social skills, right? And so I like to think about finding out who are you? What do you like to do? Tell me things that you like to enjoy. And it opens up the door to finding out a lot about our patients and clients. And so I think with the esport athlete, kind of finding out what their lifestyle habits are really important because it's at that point we can find out what needs to be changed, right? And what do they need to change and how we can help them to do things in a healthier manner. And so some of the things we're seeing with esport athletes, as I mentioned, in addition to the sleep and mood and social problems, injury and violence, also fatigue while driving, right? So we have to look at those as well. And we have to think about preparing esport athletes to engage in their activity, but also while doing so in a way that's healthy. So we have to think about recovery strategies, right? And so they're working and sitting in their station and they're using their hands, are they using their posture? Are they taking breaks, right? Are they managing their stress and using mindfulness, ways of thinking, right? And so just as Alex talked about the flow, we have to find that just right fit as well for the esport athletes, okay? So it's really important to help esport athletes establish a routine that's healthier and then help them to get more fit. So I talked about self-efficacy. I just want to spend a minute just talking about sleep because there is a correlation between sleep and mental health. And especially for esport players, who most are, especially school age, that are spending 5, 7, 12 hours at a time gaming, and you can see how that may decrease productivity in other areas of their daily life, right? Like school and friends and leisure and healthy eating and physical activity, right? That's really important. So sleep has been shown to really be important for the physiological and the psychological recovery of the esport athletes. And so it's really going to help them to develop greater problem solving and decision making skills, their reaction time, their judgment, their memory, alertness, motivation, and also really important that they have good coping skills, right? You ever not get enough sleep? How do you feel when you don't get enough sleep? Uh, really crappy, right? Yeah. I'm the kind of person, if I don't get enough sleep, I should probably just stay home and not go out into the community, don't drive or anything, because it's just not working, right? So sleep is really important, and the data on sleep and mental health is just growing and growing. And it's interesting because young adults who are supposed to get 7 to 9 hours of sleep, right? And are probably esport players. Are they getting that amount of sleep? Now, I have spoken to a few of the esport athletes at New York Tech, and they are implementing healthy daily routines. They are really working on that. So that's a positive way of really looking at it. And so, what about meal planning and fitness activities? This is another area. And so, my question is: we have physicians, we have educators, we have exercise physiologists, we have PTs, we have OTs on the team. What about nutrition experts? What about people who are also going to talk about meal planning? So at New York Tech, we do have a nutritionist who is a faculty associate as well. And can we think about maybe what are the activities of meal planning activities? So we talked about coping skills, and we talked about the importance of preventing anxiety, right? And so we can teach esport athletes mindfulness, relaxation skills. We can teach them to incorporate more nature in their life and have some coping skills. And so I know it might sound like, oh my gosh, well, maybe they may not be interested in it, but it is something that can help them in the long term, right? And so we have to look at people to be able to. So social and emotional well-being is really important, and so developing social relationships not only online but also offline as well, right? So the teamwork and the teammanship with esport athletes and esport teams is just great. That's a great opportunity to really enhance the social performance. But again, we have to think about online and offline as well. And when it comes to the campus and the community environment, we have a responsibility to think about not only what's going on with the esport athletes now, but their athletic professional term, right? And so the educational environment, the academic setting is really important, and kind of needs to merge with the community setting as well to really work with the esport athletes on what's going on at school, anything going on in the community or home environment. Are they keeping up with their health care? What about career services? We all are working in different, we will be working in different organizations as well. Is the career servicing department addressing the career of esports, right? And so there's a lot there, and then in the community as well, right? So one of the things I want to kind of leave you with, or bring to life, really I find a really simple strategy to kind of find out a little more about the sport athlete, right? Is finding out a little more about their daily routine. Because I think when it comes down to setting these goals to prevent carpal tunnel syndrome or any other neck, back injury from sitting too long or playing repetitively, you need to find out what they are doing now. And a great way to do that is to find out, tell me how you spend your day. And then really get the day by day, hour by hour activity list of what people are doing. And at that point, you can actually find out a little more about what needs to be included, changed, decreased, deleted, right? And so there's a lot you can find out when it comes to a daily routine session. This is something occupational therapists use a lot. It's almost like our safety little tool. Person may have had a stroke, or may have depression, right? And so an occupational therapist may have, tell me what's important to you, tell me how you spend your day. And it's just sort of like a way in, it's a path in to see that, okay, well, maybe you're eating on the go, and so that's why you're not eating healthy meals, right? And then maybe you're gaming, maybe you have here's just a list, right? I mean, it's list, right? Now you can modify this to show, the time of the day, and so there's all the 24 hours of the day, and then here you have activities, and then need to change important and satisfaction. And ask the sport athlete, tell me what time you go to sleep at night. So the sport athlete goes to sleep at like 10 o'clock, 12 o'clock, right? And then wakes up to get ready for the next day at about 6 o'clock, okay? So that's already 6 hours of sleep, right? Not meeting the recommendation, right? And so we can see that clearly, it's visual, right? We have some therapists who use like color coding to color in that sleep, to color in, the productivity, the work, and you can see the difference visually from out. But what about this esport athlete who is in school during the day and maybe have some gaming during the day because they're on a team, but then they come home and they're gaming again, right? And so how many hours in the day is there, and what else are they doing in the day? And so you can ask the esport athletes, tell me how you spend the day. What are the occupations and activities that you do throughout the day? What are the ones that cause you stress? When is it that you feel more socially isolated? When is it that you feel the most anxiety, right? And so it's a tool that can open up the door to other tools. Now, will you use only healing people? Absolutely not. You're using all your critical skills, observation, recognition yourself, and all the other assessment tools that we use to assess them physically, mentally, emotionally, right? But just a great way to find out what they're doing throughout the day, because we can't intervene without understanding the whole picture. And this is a great way to get the whole picture, right? But again, working with other health practitioners and collaborators as well, right? And so when we find out how people are spending their day, when we really focus on the esports athlete, especially those at risk, right? For anxiety, depression, social isolation, we can find out more about how they sleep, their time management, stress management, how they manage conflict, productivity, are they eating healthy, are they exercising, taking those breaks and maybe getting some real exercise in there. And what about their own personal self-development outside of esports, right? That's important as well, right? We gotta look at the whole person, and we have to address socialization, like I said, outside, offline as well. And maybe spirituality is important, maybe religion is important, but we have to be able to ask those questions in order to help the esports athlete have greater lifestyle balance. And we know that's a term that's probably not achievable in our society today, but what is it to that one esport athlete? What is it from the person's perspective? And so again, taking that evidence-based holistic approach, right? With our foundational approaches, our theoretical models, practice, our research, to keep each opportunity that we have when we are providing an evaluation on these things, to keep it very simple, right? So we really have to focus on the person. And as I mentioned, all of the healthy lifestyle behaviors that they need to incorporate in order to age well, right? And in order to have a great quality of life. And so we have to think about healthy lifestyle behaviors from a daily routine standpoint, right? Before we run into problems. And the importance of the entire environment, whether it's the campus, the community, the seating, the chair, the station, the gaming station. So we have to think about the entire environment as a healthcare team, collaborating with academics, the educators, and collaborating with the community, trying to understand a little more about the person and what's important to them. And that might be family and friends as well. So the esport athlete will have goals for themselves. If we focus on a person's perspective, then we're going to find out a little more about what's important to them athletically, academically, and to help them in a way that they can have greater success in their own life and in their professional career goals as well, right? And so it's just not about the game, it's about longevity. So I'm just going to end this. Thank you very much.
In terms of the esport athletes and the ones that become very addictive, how have you been able to explain this whole idea of a off season where you don't do that so that you're able to recover?
So that's a really good point because I think that with the traditional athlete, right, there's always that off time where you're recovering, even if it's during the week, but there's always that season where you're not playing and the goal is to recover. And I think that's a good opportunity for us as the healthcare team, the sport coach, to really help that person to step away from the sport. And again, I think it would be helping them identify other things outside of esports that may be important to them so that they can develop an interest for. And so that's why I think it's really important to find out what are the things they like to do in addition to sport play. And we have to occupy some of that time with different types of activities. Yeah. And we're gonna need the family and we're gonna need the whole community to be able to do that, right?
Can perform that way they can perform better and understand the idea that, well, I need no, you actually need a time when you don't perform this sport so that when you do come back to it you'll be able to do the sport much better.
Yes, thank you so much. So that insight and awareness, getting for athletes to kind of develop that insight and awareness that, this will be important later on, right, as well. So thank you so much.
I'm curious, so like, how do you manage? Because, like, with your question, like, what do they do after they're done with esport? Like, I know a lot of esports athletes, besides scrimming all the time, what they do afterward is either stream on Twitch or some other platform, and they're not really doing anything physical activity that helps break them away from staying in a computer and staying static for the whole time. Like,
Yeah, you're right. So you're talking about like within your day.
yeah, within their day, like once they're done practicing and scrimming, they go straight to streaming.
Exactly. And so that is the question. How do we break them away from that setting and that type of activity? And we can only do that by finding out a little more and working directly one-on-one, just like a coach would or a trainer would, to find out what's important to that person or find out new activities, have them even try out new activities, right? Maybe incorporate, teach about other, activities, exercise, mindfulness, and other things they need to do to really occupy their time. And without spending time with that person, it's really hard to get a sense of what would they need, what would they enjoy doing these places with them. And so the holistic view of the person and really getting to know a little bit more about what's meaningful to them and things they like to do, it would be really difficult. And so you have that person continuing to spend probably for a lot of the 24 hours in the day on that gaming and so on another platform. So I really think it's a matter of assessing the whole person and finding out what's important to them and find new things, right? Just trying new things. Is it gonna work right away? Maybe not, but just trying new things, so breaking away, especially if it's a young person, and really being able to get the parents involved and the family and
Traditional athletes tend to have well-established pathways for services like from academic tutoring or physical therapy, or occupational therapy. How at New York Institute of Technology do esport athletes access services, occupational therapy, physical therapy, or even psychotherapy?
so thank you. That's a great question. At New York Tech, studies have been sports medicine, and an interdisciplinary team of educators and practitioners. Through that team, we get together and we discuss all the different roles that we can play in working with that esport athlete. And the esport athletes, just like any traditional athletes, have access to the Center for Sports Medicine, have access to the Center for Counseling and Enrollment, have access to the Writing Center, have access to all of those different entities within the institution. So I think that's a really great question and a really great point. And that's what we're talking about with really enhancing our services and making them accessible to the esport athletes. It really does take a village, and especially to the esport athletes.
So they're housed under athletics.
Well, actually at New York Tech right now, it's actually a separate division. Esports is a separate division that works with the Center for Sports Medicine, the doctors like that. doing, just like with the traditional athletes, where they would go to the sports medicine to get their, okay to play and all those things, we have that same system for sports.
So I have two questions, if you don't mind entertaining both of them. The first one would be, have you guys ever done any sort of research or development with standing versus sitting, like a standing desk versus sitting down? Because
There is actually some research, and I see my other colleague who's upset, Alex, talking about that, and I think Alex may be able to speak to that better than I can, but there is that research going on, where, doing PTs, do exercise science, and doing Center for Sports Men, and they are actually, doing research on sitting, standing, they're doing research on the chairs, and I think they got a grant as well for improved chairs and, settings for the game.
mm,
So yes, that research is in progress, and there may be some that's available as well.
and also you mentioned a lot of the problems come from being sedentary, and since it's a sport team, that kind of leads the question: is there like a coach for the team? Does the coach ever mandate any sort of movement breaks, physical breaks, where they're not sedentary all day?
Yes, our coach, and I believe that, I'm not sure if Coach Rand still, but there is, right, okay, but, yes, they do have a coach, and the coach is actually on the committee, for the Center for Sports Medicine. And so, talk with all of the healthcare teams about making sure that these types of interventions are incorporated. So we're really fortunate at New York to be, I think we're ahead of the game when it comes to, just mental person. So the coach is aware of, healthy behavior when it comes. So absolutely, the coach is part of the team of the Center for Sports Medicine. And that's what we're talking about, that interdisciplinary, multidisciplinary, collaborative approach.
Hi. So in your discussions or some of the discussions you had with these esports athletes, did it happen to come about them viewing it as a job or fun? And if they did have a certain outlook about their place in esports, did that, and this is extremely anecdotal, but did that seem to drive their challenge to adhere to, healthy, well behaviors?
Yes, so, I had a chance to interview, because I was doing another presentation, and I wanted a recent interview, to interview two of the esports athletes. And what they said is that, they feel that playing esports is health promoting, they're eating healthy, they're sleeping well, they're doing all the things that they need to do in order to stay healthy. They're aware, and, that was, it was great to hear that they actually have those things in place. And so I think that's what drives them to continue. And they even had goals, to continue after. So I asked them, so what are you gonna do after you graduate? They had goals after they graduate. Stay involved with esports, develop their own team, or develop a new business related to it. So that's what we're seeing at New York Tech. And I think it's because of the team approach as well. Yeah, thank you. Any other questions? Thank you very, oh wait, we have one more question.
Hi there. I just had a quick question about your opinions on the relative youth of esports itself, the lack of actual resources for esports athletes, whether it's a high school or collegiate level, and the lack of that like optimal practice schedule, and whether that kind of contributes to the gaming addictions, the overplaying, because traditionally up until now, the only way to get better than your opponents was to play more.
You make a good point and great question, and I definitely agree with you. There are not enough resources available, and there are not enough resources available for various genders, populations, settings, communities, schools, definitely not enough. And so what you'll find is that, you'll find these, at-risk behaviors developing because there aren't enough resources. And when we talk about enough resources, we're talking about, again, from a mental, physical, social, environmental standpoint, the type of equipment, and so there's so much, that needs to be done there. And so, I would agree with you, I don't think there's enough resources, and I think depending on the community as well, I actually was able to read that as well. We have to think about what are the differences between male and female and other genders as well. What are those different age range, developmentally, neurologically? And so I like to think of, your question makes me think of neurodiversity, which is really looking at diversity from a whole different standpoint, really looking at making sure, based on people's ability to, use their mind and their brain and their body and everything else, are we addressing that from a holistic standpoint? So, we have a lot to do when it comes to the environment. So we need you all to really think about new ways of making sure that the environment is accessible. It's almost like the question makes me also think about, sometimes I'll go to school and I'll see this new athletic facility, right? The same thing that we need to do for the esports, to make sure that the environment, the facilities, the resources, the objects that they're using, suitable for them.
Hi, and thank you. My question to you today is, you know how many countries have like a national sports, like for example, South America, big in soccer, England, big in cricket. Do you see by any chance other countries following our trend in esports? As in, do you see like other countries, maybe Australia, the UK, those areas, also going into esports, or is this more of an American thing?
And I'm not, the e-sport expert, but I've seen most of the data that I see does not even come from the United States.
Really?
Australia, Asia, you're gonna hear a lot more with the other presentations today. And so this is a worldwide sport, and I have the feeling that the other countries have been playing esports or have more information on esports, but I also actually recently read some information, some data that showed that they also have a higher rate of addiction and some of the problems that we're seeing. And so how are they going to tackle that? So what I think about the United States is, I think we may be ahead of the game when it comes to prevention, health promotion, and looking at the whole person. Where you have in some other countries, it's all about gaming and the million, billion, trillions of dollars that are attached to it. Yeah.
Thank you.
Thank you. Any other questions, comments? Okay, thank you very much.